stop scrolling. We've got essential health tips just for you. Here, we dive into all things women's health, from nutrition to mental wellness and everything in between. If you're new here, don't forget to like, share, and subscribe. Hit that bell icon for your instant health pick-me-up. For more detailed info on today's topic, check the description below. And we'd love to hear your thoughts. Leave a comment. Stay healthy and vibrant.
Hey everyone. Today I'm going to talk about something that many women find confusing and sometimes even a little bit worrying. Implantation bleeding and its connection to fertility. Let's break it down and make it easy to understand. So, what exactly is implantation bleeding? When a fertilized egg attaches itself to the lining of the uterus, which is called the endometrium, you might experience some slight bleeding or spotting. This is typically known as implantation bleeding, and it usually happens around 6 to 12 days after ovulation and fertilization. Now let's talk about the characteristics of implantation bleeding. Implantation bleeding often occurs around the time you expect your period, which can be confusing, but it usually happens a few days to a week before your period is due. It's generally short-lived, lasting from a few hours to a couple of days, much lighter than your regular period. The blood is often lighter in color, like pink or light brown, unlike the bright red of menstrual blood. It might also be mixed with cervical mucus, giving it a different consistency. The flow is very light, often just spotting. You won't need a full tampon or pad, and it doesn't increase like a menstrual period. So how can you tell the difference between implantation bleeding and menstrual bleeding? Remember, implantation bleeding happens before your expected period, while menstrual bleeding happens on schedule. Implantation bleeding is shorter. It's much lighter, doesn't increase. Implantation bleeding is usually pink or brown, not bright red. Now what does this mean for fertility? Implantation bleeding is actually a positive sign of early pregnancy. It means a fertilized egg has successfully implanted in your uterus. This is a crucial step in conception and a good indicator of fertility. But don't worry if you don't experience it. Not all women do, and its absence doesn't necessarily mean there's a problem with your fertility or pregnancy. When should you seek medical advice? If the bleeding is heavy, like a menstrual period, or lasts longer than a couple of days, it might not be implantation bleeding. It could indicate something else, like a miscarriage or ectopic pregnancy. If the bleeding comes with severe pain or cramping, this could be a sign of a complication. If you're unsure about whether it's implantation bleeding or something else, it's always best to consult a healthcare provider. In conclusion, implantation bleeding is a normal part of early pregnancy for many women. Recognizing the signs and understanding how it differs from menstrual bleeding can help you better understand your body and the early stages of pregnancy. And remember, if you have any concerns or unusual symptoms, don't hesitate to discuss them with your healthcare provider. Your health and safety, and that of your developing embryo, are always the top priorities. Thanks for watching. Don't forget to like and subscribe for more informative content.